Welcome back, class. We're going to go ahead and cover page 25, the end of Unit 2 material. What we're going to look at is the representation of our knee joint here for a model. So if we look closely, the main thing we want to do is orientate ourselves. We know that the femur sits on top of the tibia. Well, where does the fibula sit? Is it on the medial portion or the lateral portion of the lower leg? Well, let's go ahead and just take a gander at our model right here. If we look at our model and we go ahead and take our leg, right? This is a left leg. We can always see that the fibula is always going to be the most lateral bone. So always remember that. Fibula sits lateral. So we can find the fibula. We can solve that right away. If we take our leg up on the table, we're holding a right knee. This is always a good way to look at it because you're looking at your own body, but you're most likely looking at the patient like this. So we'll start from here. Let's go ahead and find number one. That is the lateral collateral ligament. Or we can also call this the fibular collateral ligament. So simply enough, if we can find the fibula, that gives it right away. Fibular collateral ligament is going to run from the most lateral portion of the femur downward to the head of the fibula. So lateral collateral ligament. Please don't abbreviate. We're only going to accept fully spelled out answers. Number two is medial collateral ligament. A much more, I guess you say, injured ligament we'll see overall in sports injuries specifically. Now we're looking at the medial portion of the knee. So again, we're looking at the femur. We're looking down the tibia. We're looking at the ligament that runs along the medial portion, hence being called the medial collateral ligament. The anterior cruciate ligament is only found if we are able to bend the knee. So I'm going to pull away the patella here, and I'm going to gently expose, and we can see that first band of tissue crossing within the knee. That band of tissue is called the anterior cruciate ligament. Cruciate and that is crucial for knee stability. So we'll always see this as the most anterior ligament within the knee. But we can see one posteriorly as well, but I'm going to go ahead and take the knee and flip it around for you. And along this posterior portion now, we can see the PCL. But for our purposes, we need to call this the posterior cruciate ligament. Again, offering that crucial knee stability support. Now, if we bend the knee, we can see two menisci. And these essentially are the small pads that are going to be placed between the femur and the tibia to help with more stability and support for the entire knee. And if we know our directional terms, these should be pretty easy. We can find the fibula, that's the most lateral portion. We have the lateral meniscus. We switch to the opposite side, medial, and we have the medial meniscus. You can see both of those cups, medial and lateral meniscus. Last but not least is the patellar tendon. The patellar tendon is going to run from the patella down to the tibial tuberosity, which we learned before on the tibia. Span of tissue right through here. Now, if you are somebody who has ever torn an ACL, okay, you'll often hear about these terms. ACL, anterior cruciate ligament. If that's torn, sometimes what they'll do is they'll take the patellar tendon, a portion of that from it, remove that, piece it back together, and then go ahead and place in a new ACL for you. You can also have a hamstring tendon, or, you know what, go with a cadaver. It's up to you. Again, though, here is your knee joint. All the major points, one more time. Medial collateral ligament, lateral collateral ligament, patellar tendon, medial meniscus, lateral meniscus, anterior cruciate ligament, and posterior cruciate ligament. Enjoy.